As a home visitor, typically we see women who are pregnant or children who are, or families who have children age 0 to 6. And my main purpose is to support them in whatever goals they have to be a healthy, thriving family. So that can look really different for each family.
I usually have a list every week when she comes of questions or, concerns or whatever it may be, or something that she can help me out with.
For some families, it might be meeting basic needs and supporting them in that, whether it be access to housing, food,
filling out applications, to meal planning,
applying for healthcare, finding a provider,
making phone calls, making my kiddo's first dentist appointment,
help with routines and schedules for their children, whether it be their first child or maybe their 5th. The project I've been working with has been working on integrating the community agencies such as parent-child centers and family resource centers into the clinic community.
So parent-child centers and family resource centers are always working with the family as a whole. We would not work with the child without also knowing their family.
A provider can refer to a family resource center or a parent-child center really at any point that they're meeting with a family where they hear that there's some kind of stress in the home or any kind of challenge that may affect a family's ability to be thriving and healthy, which can be really anything.
Anya's really available to help me with any sort of thing, and if she can't help me with whatever I might be working on or interested in, she usually can point me towards, the right resource to do so.
The whole purpose of our existence is to help families have what they need to be successful, especially in those early years when there's so much changing and it's such an important time for kids and sometimes extra stress for families. So our whole goal is to be a resource for families during those times, making sure that parents, as their child's first teacher and the most important people in their children's lives, have what they need.
I think the biggest take home of this project thus far has really been the broader community understanding what a parent-child center is or a family resource center if they're in New Hampshire, because that's really first and foremost is what is this community agency, what do they offer, and who would benefit from that. Including the providers themselves. We've even had some providers who access these services, which I think says a lot about our community.
If I ever was trying to, tell a friend about, like the services that I've engaged with, if they were ever hesitant, I would tell them that I was hesitant too.
It's also really important to say that our services are voluntary and open to all families, and we really see it as a sign of strength for a family to reach out for support or to want to get involved here.
Reaching out for help, they say, is, a sign of strength, not a weakness, and I think sometimes if someone hears that, they might have a different outlook, certainly because, knowing that and hearing that certainly helped me.
It's in all of our interests to make sure that families have what they need at the beginning of their children's lives, and we're here to help.